Richard and I said, listen, what if we were just to find a way to build a care coordination tool so that we could really be that care assistant in the ER? Because the sickle cell patients told us, the moms are saying, yeah, I'm there with my child now, but what happens when I'm not there, when I can't advocate for them and they're in horrible pain in the emergency room? If you're really serious about this, Michael, if you're really serious about this, Richard, why don't you build something to address that? So we started talking to the sickle cell community. Spent 6 months in customer discovery. Some of those people are in this room saying, tell us what we need. And they told us how to build the app that met their needs. But then that was in September when we started last year. And then around November, they said it's not enough. They said something that Dr. Powell echoed. They said, we got this handful of doctors in the community that have a desire to take care of us. They don't have the capacity because the hospital, the insurance companies rather, are paying them a small amount of money a couple times a year, and you can't manage complex care patients like that. And then we got these large academic institutions, and they're really nice institutions, and sometimes we get treated well, sometimes we don't, but we always feel like they're trying to figure out what paper they can write on us, what study they can put us in. And we really want to see if you're really serious, why don't you try to help the doctors in the community who are really interested in taking care of us build a sustainable business model? And that's when we went to Dr. Powell and Dr. Anya Bula and Dr. Collins to say, what if we could build a value-based sustainable model to manage sickle cell patients in a specialized medical home model? And to their credit, they stepped up and said, let's talk about how we make that work. Then we talked to Dr. Tandua Washington and said, well, if I were involved in this is what I would be doing as well. And we took all that information starting since last November and started building. And we used the platform, the information management platform that you're going to see here, to support that.
With an organization like Marti Health, what we're looking for is to make it easier for caregivers to be present for their warriors, to make it easier for them to receive the proper education, the proper support, the proper resources, so that they can be engaged in their care, they can be proactive, they have great access to quality, affordable care. And I think that is going to be huge as we look at, the impact that we can have.
Most of us dealing with sickle cell patients ain't nothing to do with money. We're doing it because we want to. So we all got to band together and fight. So I've been working with Dr. Smith for the last year. Are you go into a room, the nurse said, well, they don't look like they're hurting. I mean, how are you supposed to look when you're hurting? You can be asleep and still hurting. So they're using the wrong parameters to make some decisions about what patients need.
By the time the second doctor came in, I was crying, not from the pain, but from the frustration of even having to explain that and go through that. Like, what does sick look like? Unless you see me every day, you can't tell when I'm in a crisis. My support system know when something is a little off because they see me every day. But if you don't see me every day, you can't look at me and tell that I'm in a crisis. So I'm happy to help Marti Health with pushing this app because I believe that it would put a lot of accountability and ownership in the patient's hands. All that the app entails really, I feel like, is a patient empowerment tool.
We see Marti as an opportunity to do that. So we are building a specialized medical home model for sickle cell patients. And we're using technology to support that, but it's really focused on community-based participatory engagement, using best practices for standard of care, and then taking the best technology available so that we can find ways to engage the population and deliver the kind of support they need in real time wherever they are. And among the things you'll hear about is we took their advice to build an acute care plan system so they can put all of their records into their smartphone. When they show up at a hospital that's never seen them before, they can say, here's everything you need to know about my acute care plan. This is how Dr. Powell manages me when I'm in the middle of a crisis. If you don't believe me, here's his contact information. Our real model, the success for this model, is not based on making money out of the sickle cell population. Sickle cell patients can download this app and use it for free. The real opportunity here is to take risk on improving the outcomes for this population, taking this team of people that you see here, the physicians, the community-based organizations, and taking risk on identifying and documenting the burden of illness of this population more comprehensively and more proactively, closing their gaps in care, medical, behavioral, functional, social gaps, allocating resources to reduce ER visits and hospitalizations. And the same things that will reduce that will reduce the vaso-occlusive crises and hopefully reduce the concern around this soon to come $2 million per person treatment that is a great opportunity, but by the best estimates, will probably only be available to 15 to 20% of the sickle cell population. We want to do something that raises the health care of all of the sickle cell patients, not just the 15 to 20% that may or may not be eligible for gene editing with that.
Having all those perspectives was really helpful. It's so important to hear the voice of those who are living sickle cell every day, or caring for someone with sickle cell, or treating someone. So that was really helpful. And then to learn a little bit more about Marti Health. I already had some knowledge of Marti Health, but able to see the app and what the plans are today, what the plans are for the future, I think there's a lot of exciting things to come.